Sure. So this presentation comes from a couple of pieces of work that kind of happened by coincidence. So back when we were doing the Life Course project, which was a National Science Challenge funded project that I presented at the colloquium on several times, we were looking at outcomes for children who have a family member with a long-term health condition. As we were starting to look at that data, we realised that there was some data in the census on whether young people were caring for another person who was disabled or had an illness, and started doing some work with Young Carers New Zealand and an organisation called Unseen Heroes, who run support and camps for young carers. And we've been kind of going along trying to get that data published, or trying to get it written up and published. And then last year earlier this year, beginning of this year, we completed a project for Ministry of Social Development. They wanted, as part of the revision of the carer strategy, they wanted to know about what data are available in New Zealand around carers. So survey data, administrative data. And because we were already doing this work around young carers, I got particularly interested in what data there are for young carers. We're talking about informal unpaid care. So we're not talking about young people who might have a job as a support care worker. We're talking about young people who are providing care for family, perhaps in their own household, or it might be family, friends, neighbours in a different household. They're doing that informally, it's unpaid, and they're providing that assistance to people who are disabled, or who have a health condition, an injury, have age-related needs. Importantly, for young people, often not captured in some of these definitions. So this definition is from Mahi Araha. Young people might often be caring for a sibling because a parent is unable to provide, care because the parent is disabled or has a illness. And so the definition doesn't, we think, quite capture all young carers. But generally, we are defining those people as those under the age of 25. So, could be very, very young children, could be helping out with siblings, could be helping their parents. We kind of put that cut off at 25. So I've included a couple of kind of infographics there from the carer strategy around young carers. And this is what the Mahi Araha says about young carers in particular, that caring can impact young people in terms of their ability to study, ability to go to school, whether and how they transition into employment, and the way that they can spend their lives. And they are 3 action plans that relate specifically to young carers. So improving data, supporting inclusion of young carers in policy development, being able to identify and support young carers. It says here to access the support they need. I think it should be to provide them with the support they need, rather than the onus being on them to access support. And then action 4.2 incorporates young people when we think about education, training, and going into the workforce. So the type of data obviously is vast. The review we did with MSD and what I'm going to talk about today is mainly around quantitative research. And I'm going to mainly talk about some of the survey data that are available. There are some administrative data available, but it's pretty restrictive. There was a lot more data available relating to carers and caring activities in New Zealand than we thought. We unearthed quite a lot of data sources, but most of it relates to survey data. And particularly when you come to looking at young carers, we've got really 5 key sources of data that I'm just going to go through what we know about the results from that data. So the Carers Alliance, Carers New Zealand run a survey every 2 years. So the last one was run, I think, this year. The results aren't published yet. They define young carers as under the age of 35, which is obviously quite different from that usual definition, and obviously it also includes people who are already established in their working lives, in their family lives. And actually very few of the last survey in 22, very few of the sample were under age 35, which maybe is why that cutoff was used. We don't know how many of those respondents were under the age of 25, but we were able to get some data on people under age 35, looking like there's some issues there around the impact on their mental health, their physical health, and their ability to work. And whether, I think the most last one, the extent to which people feel valued by their families and by the government. That's pretty much all we know about young carers from those surveys. The Youth 2000 surveys and the now Ministry of Social Development, Youth Health and Wellbeing surveys have asked quite a lot of questions to young people around looking after other people. So whether they are looking after someone else on a regular basis, who that person is, whether looking after that person leads to them missing school. Again, this is all we know at the moment from this data. So this is from the main report from the Youth Health and Wellbeing survey. So around, you can see over there, 26% of young people looking after someone else regularly, really different rates according to whether you look at different ethnicities. As we often see, a higher proportion of young women caring for other people. So these are all young people aged 12 to 18. So the youth survey involves secondary school students. So these are under 18s, a younger group than we would normally see data for. And we can see that if we look at the extent to which people are missing school, they were asked to rate that on a scale of 0 to 10. So 0 is often and 10 is never. So we can see again some variation among different groups around the extent to which people are missing school. But this is all that's been published so far. Growing up in New Zealand. So when the children in the Growing Up in New Zealand cohort were aged 12, they were asked about whether they were helping to care or helping somebody older than them with everyday activities, getting dressed, washing, etc., and whether they were looking after somebody younger than them. Again, this has been analysed, the data, and it has been reported but not published yet. But so this is what we know, that there are a high proportion of 12 to 13-year-olds who were providing care to some extent to someone older than them, not necessarily very regularly, but quite a few on a weekly or daily basis. There was differences among different ethnicities according to whether people were providing help to another person. No differences in gender at this age, this is the earliest age we're able to look at. So that's interesting to see. Maybe that gender difference comes later as young people get older. And some other differences around, as we would imagine, if you live with extended family, you're more likely to have older family members, so perhaps more likely to be providing care. And if you're, same with intergenerational families, you've got more people around you and more likely to have older family members. So this is some of the data that we used when we were doing the Life Course project. So this is from the census. So all of the censuses, and this is the only place that this question is asked, is in the census, ask about unpaid activities that people are doing. So are they providing care for somebody inside their household, or are they providing care to someone in a different household? This is, of course, asked of everybody age over 15. So we get a really lovely big sample of people. And the extent to which they, kind of recognise that they are helping somebody with a health problem. It is, I think, a little bit more restricted. I'll talk at the end about the types of questions that these ask, but we can see mainly, this is unpublished as yet, but will be available in the Compass YouTube videos of previous colloquium. But what we see mainly is a large number, 42,000 young people, I think is a considerable number of young people, lots of variation across different ethnicities, And these are young people who are doing a lot. This is, so the blue line there are people who are not providing care to someone with illness or disability. The orange ones are carers, but those carers are also doing a lot of household work. They're looking after children in the household. They're looking after other people's children outside the household. They're also doing a lot of voluntary work. So these are young people who have a lot that's going on that might well be impacting their health, their education. Bringing us more up to date, one of the reasons we've been kind of continuing this work is because unseen heroes who are, trying to get funding to provide support for young people, we're constantly being asked, well, how many young carers how many you want to run a camp in this area? How many young carers are there? And so we've put together a dashboard. My master's student, Chase Wu from data science, put together this dashboard so that we can actually use 2023 publicly available data just to have a look at what we can see in that data. You can look at different areas within New Zealand, and you can break that down by gender and ethnicity to look at how many people identified themselves as young carers according to the 2023 census. So ultimately, what we found is a surprising, I think, amount of data available. So these 5 data sources, they relate to quite different groups of people. So Carers New Zealand is anybody, don't always know how young those people are. Youth surveys, age 12 to 18. Growing up in New Zealand, they were age around 12 to 18. Census data and Te Kupenga data, age over 15. So there's a lot of data there, but what we found is it's not being used. So there's very little published. Nobody has analysed the Te Kupenga data. The census data has not really been published. Like I said, we're working on that, and what we really want to look at is those impacts on young carers over time. And a lot of those youth survey data is all sitting there. It can be accessed by researchers, but it hasn't been fully analysed. So what do we know? There are a considerable number of people who have experience of caring for others. It's likely that the current data really undercounts that, because a lot of people just don't identify themselves as being a young carer. Regardless of how you ask the question, they don't recognise that in themselves. We can see that the proportion of young people who are carers really varies according to different socio-demographic factors, and that young carers do more than just caring for people with support needs. They do a lot else in the household, looking after other people who might not necessarily have support needs. We really don't know yet the full extent of those impacts, perhaps positive and negative, of caring on young people's education, longer term employment outcomes and their well-being. There's plenty we can be doing better, so we should be ensuring that young carers are counted and that their voices are heard. We need to enable young people to recognise that they are carers and to feel pride around that, and to make themselves known and reach out for support. But we really need to be directing services to those young people to support them and providing them with spaces where they feel accepted and valued and understood. So I think we really have a lot to do in terms of understanding the role of young carers, the contributions they make within families and communities. As our population ages, there will be more and more will probably be more young people on which caring responsibilities fall, and we need to be making sure those people are supported. We need to enable services, schools, employers, mental health services, disability services to recognise young carers and direct support to them.
Firstly, I'm going to preface this by saying sorry. This might be a bit of a big question and it's probably relevant to all of the presenters today. I suppose it's really relevant to me because as someone who works in our data lab, we don't even have windows, let alone, we can't even look outside. How do we connect with the public? Do you guys, even yourself or your Compass group, do you have like a communication strategy for how to link with policymakers, how to kind of get your research out there to people who can put policy in place to make those changes?
Do you want to answer that? Or
You do it.
I don't mind. So we work closely with the Public Policy Institute at the University of Auckland.
Yeah, so there's I guess a few different strategies, and it depends on avenue and what you're doing. There's the Public Policy Institute, as Lisa mentioned, and part of that involves putting together policy briefs. For example, we I think try to engage a lot as well within forums such as these, but other forums where we can present our work and share it so that people are aware of it. And then I think a big part of this, for example, is like the community partnerships that we have. So we try to, we really emphasize working with communities, and then part of that work, quite often the communities will also have their own kind of advocacy work or connections that they're doing that the work can complement or support in what their goals are as well. So yeah, it's sort of around building connections really, and it is, when you are in the data lab, it's tricky, but I think having those opportunities for like dissemination like this, whether it's at a conference or any sort of forum, or just meetings, etc., that people are in a similar space, I think is the key thing.
Yeah, and I think, for example, this work was partly because MSD funded us to do this carers review, and so quite often that ministries are the funders of what we're doing. But me personally, I prefer to be responsive to the community. So when community groups come to us and say, like Unseen Heroes, every time they applied for funding, whatever regional council was saying, well, how many young carers are there? And they couldn't answer that. So that's why we did some of this work, so they can then use our platform now. So that's where I'm at, is whatever the community groups want me to do, as long as we can find some time and funding, then that's what I'm interested in doing, and giving them the data they need. They're the ones who know what the needs are more than I do, for sure.
Yeah. Thank you.